Social Care Act within our country, underpinning this, running this from behind the scenes, are these huge international concerns. It really is a huge issue, and it's something that we must keep our eye on. We don't know when these negotiations are happening. It is so secret. I have found out that there are new negotiations coming around October. We don't know who the companies are involved. We don't know who the lobbyists are. We don't know who the people are. But believe me, it would undermine all legislation that we have in our country. So we must keep our eye on that. And I did notice over the back, somebody's got a campaign going about the effects on the NHS of this international corporation. I'm picking up a few pickpockets that people have slightly missed. One of the purposes of the legislation is also to introduce an insurance-based system into this country. My niece lives in Seattle. She has severe asthma. She is a researcher in diabetes. She contributes to our society. She can only afford a certain level of insurance. And so, towards the end of each year, she absolutely prays that she's not going to have an asthmatic event because it would bankrupt her. She's a young woman. And if you've ever dealt with any insurance companies, you know quite well that if you have an insurance contract, you try claiming on it. There are always companies who want to wriggle out of it. They always want to find a way not to pay. And the companies that are currently advising and gearing up to take over our market are currently, the three big companies, are currently in court in the USA, because they are American companies, in the USA in court for wriggling out of their responsibilities, our insurance companies. So that's the sort of thing we're talking about. I'm nearly 70, and I went online to see how much my premiums would be. It's quite interesting. If you're young, which is where all the advertising now is going, premiums are relatively small. You think, oh, I can manage that, no problem. Until you get something wrong with you, or until you start getting old and you get multiple pathologies which start undermining your risk as a customer of an insurance company. So those are the systems that we're actually looking at. Incidentally, somebody mentioned that Margaret Thatcher would have a view on the NHS publishing. Not so long ago, I found out that in the 1982 Cabinet Papers, that nice dead sheep, Geoffrey Howe, suggested that this was their opportunity to privatise the NHS. And that wise old bird, Margaret Thatcher, said, no, we're not ready for this. Bear in mind, 1982. The country's not ready for it. We have strong unions. We have a huge will behind the NHS. We have a commitment to that sort of thing. We're not ready. And as somebody early on said, they've had 30 years to build up this campaign. Somebody mentioned teachers, and the process is the same.
Oh, yes.
They tested it in education. Do you remember the days when teachers were respected? I was a teacher, this is my background. Do you remember when nurses were angels and were the most valued people in our society? Over the last 30 years, that campaign to demoralise, to denigrate, is there for a reason. They've started making people worried. They frighten people. They are undermining people's confidence in our major institutions. And at the same time, up comes the rhetoric of private healthcare. You'd be safer if you had an extra bit of insurance. You'd be in better hands. You go see all the pictures of these beautiful resources. I'll tell you what happens, another story, I'll be really, this is my last story really. A friend of ours, the wife had cancer of the esophagus, which was treated wonderfully in the NHS, no problem at all, fine. Sometime later she developed a lesion on her nose, which was worrying. So she went back to the consultant and he said, not good, but really under control, no problem at all. It'll probably take a little bit of skin graft, but it can be dealt with. However, you have a choice. So she was sent over to Nottingham University Hospital, where the system there is private. She went into a beautiful waiting room with carpets and flowers and up-to-date magazines. And so she went in and the consultant went, you know, the builders. And he said, that is nasty. I'm worried about it. You will need a series of tests. You will certainly need to come in for a time while we examine this and we take biopsies and so on. This may well take a series of grafts and it may well be a long process, including hospitalisation. Private health care. The diagnosis, overdiagnosed, expensive. You could see the dollar signs or the pound signs in the consultant's eyes. The end of the story briefly was that she chose the NHS doctor, everything is fine. But you can see how the system is open to abuse, how all of this is building up. And of course the taxpayers pay for it. Profits paid for by the taxpayer. So services must be cut. So I'm just going to move on really quickly to our campaign. We campaign every farmers market in Belper. We must speak to hundreds of people. In fact, they know we're there now, so they come up and we have to keep updating our leaflets. Our leaflets are very, very positive because of a demoralised health service. We have got to keep saying the health service is good. Keep it simple. The health service is still the best in the world. So we keep saying this. We keep saying the staff in the health service are the best in the world. We gave them all Valentines on Valentine's Day. And they were so delighted because they are so demoralised and undervalued. How do you convince people who come up to us and say, I don't believe you? They'll never sell off the NHS because they don't know. They see the ambulances whizzing round and in the small print, it says, in the service of the NHS. Blood tests are private. Podiatry is private. X-rays are private. People don't know. So when anything goes wrong, they blame the NHS. They actually think that it may well be the NHS is wrong. So we have to be a bit more cunning about our strategies. You can't tell people who are convinced that they are wrong. You've got to go around the houses. You've got to start building confidence. You've actually got to use imagination. Plays. Got a play up in Chesterfield. It's a really good play. It's called Carry On NHS. Okay? We've got a song contest supporting the NHS. Use humour, stories, plays, creativity, those wonderful banners that people are doing to celebrate and support. And we've got to use courage. We've got to be prepared to go into areas that we've never been in before. My background's not NHS, I'm education, as I say. I had to go and find out about these CCGs and all these bizarre places with a language that I don't understand. We've got to do it. And of course, talking about courage, we've actually got to support those people who are doing so much. Those wonderful women who are just 9 ordinary women who have the imagination and the courage to resurrect that powerful Jarrow March and really bring people's imaginations and confidence alight. When people are demoralised and frightened, they don't know where to go. We've been developed into a passive society. We sit and we scream at the television. We listen to people pontificating. We sit there and we've lost the will to get up and get going. And that's why things like this are so good. We start talking to each other. Just finally, today, I've infiltrated the WI. And today, we had a trip to Liverpool. 49 women from Duffield, which is a bit posh, into Liverpool on the bus. I had to say, I'm sorry, I'm not coming on the bus, I'm coming here. Why are you coming here? So I told them. I didn't say any more. I just said, I'm coming to talk about what's happening in the NHS. Those 49 women talked about the NHS, brought out stories. They were probably all voted Tory, but it didn't matter. They were talking about it. And I tell you, when we're in the streets in Belper, this is a cross-party issue. Nobody's differentiating here. They are all in defence of the NHS. So, go forth and...
Before we finish, is there any questions to Chrissy from the floor? No? Well,
yes.
Sorry.
I was just going to say, the TTIP campaign on the NHS is at the back. Please sign a postcard before you leave. We intend to deliver them to David Cameron to encourage him to use his veto in the negotiations against the NHS. So there's lots of other campaign groups across the country, and they're linked within Europe as well. So here we are trying to push this forward, and so please come and have a look, sign the postcards, and there's also a few flyers as well which you can take away, which give you a little bit of information on the TTIP issue.
Sorry, Keith.
Just to conclude, Jackie said, if you'd like to buy her badges, they're there. And the books, well, missing somebody bought. Books are £8. Can I just say that Chrissy and others have come across from Derbyshire. We've been trying to get things going, and if you want any help in East Staffordshire or in South Derbyshire, there are people, that maybe 100 people who would like to help you. So do get in touch with us, and we'll do what we can. But buy a book or a badge as well, that'd be great.
And just to conclude, it was said to me early on, what can we do? Where are we going from here? Well, what we can do is take what's been said from the top table, and we can take that message out. We can take that message out and spread it to the general public. That's the first thing. Secondly, I think I've got to thank, obviously, the Cancer Not-for-Profit team for their hard work that they've put in. Especially Sarah, because she's been bombarded with phone calls from herself. Rick, who sat at the back very quietly, and he's completely ignoring me, but that's fine. But Rick's put a tremendous amount of hard work in. Margaret, obviously, for her knowledge and sharing and putting up with us from Burton-on-Trent at the Staffordshire meetings for Cancer Not-for-Profit. But the last words are, it was said, great appear great because we're on our knees. Now let us rise in defence of the NHS.
Absolutely.
Sorry, thank you. And that's us concluding, obviously, and thank you to the top table.